Welcome, everybody. It's Health Talk. That's John King over there, struggling, not yet cursing at the computer, but it's close, right?
Yeah, we're on the brink. We're in detente now, I think.
How does that phrase go? To err is human, but to really screw up, you have to have a computer, right? Anyway, well, we have a special guest in the studio. Oh, let me just get that, I don't want to kill you. Plug that in there. You can do it, John. I got it? Okay. Can you hear me?
I can
Can you hear me now? Okay. All right. We have a special guest. This is so professional. Maria Gurreri, who is an RN at Community Medical Center. Now, you've been doing this for a long time, right? Welcome. First of all, welcome to the show.
Thank you. Thanks for having me.
It's nice to meet you.
It's great to meet you.
All right. So now tell me a little bit about Maria.
So
and I promise I won't sing the song. Go ahead.
You can.
And I won't ask you to.
If I pause,
I won't even ask you to take a letter or any of that stuff. So go ahead.
So I am the pediatric infusion nurse coordinator at Community Medical Center, and I've been at pediatrics for the last 20 years at Community. Been a peds nurse for 24. So yeah. So I'm
sorry,
here.
you don't look old enough to have been doing anything for 24
I graduated
years.
nursing school when I was 13.
Wow. Yeah. She was a child
and
prodigy.
Here I am.
She was a child prodigy.
No. So,
I know.
Yeah,
Where'd you go to school?
I actually went to college at the University of New Mexico in Albuquerque.
Okay.
So.
And what in the world brought you all the way to Montana?
Yeah, so I followed some family out here, and here I am. I mean, I grew up in upstate New York, and here I am in Montana, so.
I thought she was going to say she climbed every mountain to get here, but...
But she did ford a few streams.
Almost.
But
so,
anyway,
yeah.
anyway. So tell me a little bit about, now, for those of us who are confused about infusion, I wanted to use that. What is infusion?
So pediatric infusions are specialized medications that kids that have any kind of array of disorders, like from rheumatology disorders, gastrointestinal, immunologic, kids that have cancer, come to us for either like an IV push medicine if they have cancer and they need their maintenance chemotherapy, or kids that need infusions anywhere from 30 minutes lasting up to 8 hours for issues such as juvenile arthritis, Crohn's disease, irritable bowel disease, ulcerative colitis, things like that. Kids that have cancer that have leukemia or Wilms tumor, things like that, they'll come to Community and we'll actually administer their infusions.
So what sort of things are you infusing them with? Like drugs
So
or medicine or chemicals their body can't make anymore or what?
So just for example, kids that have like juvenile arthritis, they have an inflammatory process that happens in their body. So we might administer a drug called, for instance, Remicade. So, and that drug basically targets one of the inflammatory markers in their body that's causing that inflammation to keep that inflammation down. So, and those kids need those infusions regularly, and these are on top of some oral. This isn't just IV medicines to manage their disease. It's not the first choice. So it's basically these kids get oral medicines first, and if those don't work and they're just having a hard time with their diseases, then they'll come in for these IV infusions based on the recommendations from their specialist.
Okay, I can understand. I've been around in clinics where adults are getting like cancer infusions, things like that. And it's tough enough for a grown-up who kind of knows what's going on. They can understand. They can really kind of perceive and read and do some research. But with these little ones, I mean, you must meet the bravest people on the planet,
that's
right?
For sure. That's for sure.
So tell me what that's like to be dealing with kids in that type of situation.
You know, first of all, I think our pediatric nurses we pride ourselves on just working with kids really well, loving to work with kids. I think you have to love kids to work with them. I mean, they're also much wiser than we are. And so I think kids teach us a lot. You know,
like in what way?
You know, they're just they know their bodies. They know when they don't feel well. They just want to feel better. They want to live in the moment. And I think for kids, definitely they've taught me to be grounded and live in the moment. And what's so rewarding for me as a peds nurse is to see these kids who come in, you know, for instance, for infusions that come in, they can't play sports, they're achy, they feel bad. Maybe kids that have irritable bowel have, you know, issues, you know, it's hard. There's stigmas attached to it. And we see these kids, we're giving them their infusions, and then I get to see them 4 weeks, 8 weeks, 12 weeks later, and they're different kids.
Wow.
They're out playing their sports, they're with their friends, they're forgetting about their diseases, which is awesome. So
So they have really good forgetters.
Exactly. They are. Yeah. And I think, you have to be very, we're very specialized at Community Medical Center in pediatrics. So you have to know what you're doing. We have 4 pediatric hospitalists and 1 pediatric intensive care doctor. Our hospitalists are on site the entire time the kid's having the infusion.
Yeah, we met the pediatric surgeon.
Yeah. Dr. Beals is one of our pediatric surgeons. I think you met Dr. Flass, who's the gastroenterologist who comes from Kalispell, and which brings us into the pediatric specialty clinic. We have doctors from all across the state and even in Seattle who come to our pediatric specialty clinic, and kids are seen over there. We have some great programs at community that I think a lot of Missoula doesn't even know about. Besides our pediatric inpatient unit, we've got our intensive care unit, we have our specialty clinic. We have, like I said, our pediatric surgeon comes. He goes to Seattle for surgery. I mean, we have some great programs that I think people just need to know about and have their kids come here. So
when it comes to the infusions, it sounds like a lot of these diseases that are dealt with infusions are chronic, things that they may deal with for the rest of their lives.
Exactly.
So you have a pretty good relationship with some of these kids, I would assume, at this point. It's not like we're going to fight over having to use the needle or anything like that.
Right. No, and that's that's unique. So our program's we've been doing pediatric infusions since 2005, but the program has really grown. We're seeing a lot more kids these days, and I think Dr. Flass touched on that last week with just all the autoimmune diseases we're seeing now that we weren't seeing 20 years ago. I mean, I've been a nurse for a long time. We weren't doing these types of infusions back in 1992 when I graduated.
Well, let me ask you, if I could just interject here, why do you think these diseases have made such inroads, especially in kids, over the last 20 years? Is it environmental?
I think there's a lot of factors. I think there's definitely genetic predisposition as well as environmental factors for sure. I mean, I think, the way that there's definitely things in our foods, there's pesticides in our foods, et cetera, that are just coming out of the woodwork. And I also think there's research being done. There might have been things that we didn't know were happening 20 years ago that now they've done enough research to figure those things out, which is so amazing. And I mean, the amount of medicines that you can now treat and do with these infusions with is really impressive. So.
Wow. So when you were starting it in 2005, was that like a new thing in the country or?
No, I think, definitely they've been around. I mean, we started out just maybe doing steroid infusions is what I can remember back in 2005. Those were the first kids that we were doing that needed steroid infusions maybe for 3 days. And now it's into these elaborate, what we call monoclonal antibody therapies that we do. I mean, it's quite technical. You have to know, we know what we're doing. Like I said, our doctors are super specialized and know what they're doing. They work with a specialist out in Seattle. I mean, it's a team effort for sure.
If you'd like to visit with Maria Gurreri, she's with us this morning from Community Medical Center. If you've maybe dealt with this, or maybe your child is dealing with this and you want some advice or comfort or whatever, give us a call. The nurse is right here. 721-1290 is our number. All 4 of our lines are open, and we'll be right back with more Health Talk in a moment. Okay, we're back on Health Talk from Community Medical Center from day one. Our guest is RN Maria Gurreri. She's been a pediatric intensive care nurse for 24 years, and we're having a really interesting time talking about this, especially dealing with kids. It's a very specialized area. Go ahead, John.
Yeah, I had a question for you. So 24 years, you must be pretty good at giving shots and putting needles in kids.
Yeah.
So what's the talk up? I mean, what's your approach? How do you get them to be like, okay, I'm going to extend my arm. I'm not going to freak out. I'm going to get the sticker when I'm done.
No, the thing with kids is you have to be totally honest with them. You tell them everything you're going to do. I mean, I tell them from the time they get there to when they sit down, if I haven't met them before. Now, the kids that we've had before, that's a whole different deal. They're like, okay, here's my arm. No, like literally I'll have little kids like totally fine with their IV starts. You just have to be honest with them. There's no surprising, there's no jumping on kids. You have to just, you develop trust with them right away. I think you get down to their level, you talk to them, you just tell them what to expect, and you don't lie to them. If it's going to hurt, you have to tell them it's going to hurt, right? I mean, you don't want to say, oh, this is just,
So what do you say? This is going to hurt.
Yeah, I say it's going to be an owie.
Oh,
yeah,
okay.
it's going to be an owie. It's, it might feel like a bee sting, this is a tight rubber band. I mean, a lot of times the kids just with the tourniquet, they hate it. So if you tell them, it's not to say that they don't cry, but you just comfort them. And then as soon as it's done, and you tell them like, okay, we're done now and we're going to move on to this. And kids forget really quickly. We have iPads, we have TVs, they're in private rooms where they sort of forget about everything. Once the IV start is done, then things run pretty smoothly.
So you just load them up with media while they're getting their injection, right?
Exactly. If their parents are okay with it, we're great with that. So
you got the entire Disney collection, I'm sure.
Totally.
Okay, so do you think that some of the grown-ups should come in and watch the kids and how brave they are?
Exactly.
You know what I mean?
Yes.
And so when they come in, okay, I'm a little bit ashamed of myself now for being such a whiner. Okay. Right?
It's true.
Does it work that way?
Well, kind of, yeah. Actually, I have some parents that need to step out of the room.
Oh, really?
So, yeah, and it's fine.
I can understand that.
That's fine. You have to respect that.
Poke me, not him,
You know what's cool is a lot of these kids come with their siblings, and their siblings are there to hold their hand, and I can tell how scared the siblings are. Like, they're so glad that it's not them sitting in the seat.
Sure.
But it's just a really cool relationship that we see with that. I mean, kids they have to trust you. And like I said, I think all of our pediatric nurses are so good at getting that rapport quickly with kids. We know these kids by name. I see them. We see them, some of the kids every week. We know their families. We know their background. We know their medical history. Some of the kids that go away to Seattle and the bigger hospitals, per se, they come back and they say, oh, I'm so glad to be back at community where you guys call us by name. So it's a great thing. I mean, we're definitely a family on the peds unit.
So when it comes to the types of diseases you see that you treat with infusion, what is the most common?
So I'd say juvenile idiopathic arthritis is the most common, and then gastrointestinal diseases like Crohn's disease, irritable bowel is the second most common. I mean, I don't know if people know the statistic, but about 300,000 kids in the U.S. suffer from juvenile arthritis. So it's pretty impressive.
How would you know that your kid has juvenile arthritis? So
there's different signs for sure. I mean, it can start as just joint stiffness. It can start as inflamed joints. It can start. I mean, some arthritis affects their eyes. I mean, there's just a wide range. And generally, what happens is these kids go to their primary care physician, and then they come with these symptoms. The primary care doctor figures out, there's something more, refers them to the specialist, right? They might go to this pediatric specialty clinic where a rheumatologist goes a couple times a month, and then they'll see them. They also can do blood tests to diagnose them. There's certain markers, in their blood that tells them, this is definitely rheumatoid arthritis or not.
Now, do you have waiting lists of kids that need to get in for this infusion? I realize if there's a lot of people, and do you put them in by order of priority of this isn't urgent, this can wait, this a week or so? How do you do that?
We're fortunate enough to work around schedules for sure. I mean, we do infusions a couple times a week right now. We'd like to expand that even more to 3-4 times a week.
How could you do that?
So, I mean, we basically just go by the volume. So if I get a new referral, say from the pediatric specialty clinic, I work really closely with Heather Marshall. She's their specialty clinic coordinator over there, and she'll send me over a referral. I try and get the kid in like the next week or 2 weeks. So if it's a matter of us adjusting our day to get that kid in as soon as possible, that's important. And obviously working around the family schedule. We have families that come in from all over the state. I mean, as far away as Cut Bank to, Browning to Great Falls, from wherever. So.
And what does the family do while the child is getting treatment?
So they come and they're right there in the room, and they hang out in the room.
Oh,
yep.
That's cool.
Yeah, and what's also cool about community is we have the Ronald McDonald House.
Right.
So if we have a family that comes in from out of town, we can arrange ahead of time to get them in the Ronald McDonald House and stay there. So.
Is it always just kind of managing the disease, or does infusion ever lead to a cure?
It's not a cure. No, it's definitely just it's basically just manages their symptoms for sure. So, but I can tell you their quality of life. I mean, I was telling you on a break, I'll see these kids 2-4 weeks, from their diagnosis, from when we start the infusions, and they're playing, they're doing their sports, they're back in school, their confidence level goes up, they just feel better. So,
So like my father-in-law, he's got diabetes. He has to give himself a shot and take care of himself at home and watch out for himself. And is there a point in the future where you think that these infusions will be done at the home?
They definitely are. Yep, definitely done in the home. And right now in Missoula, they're not. We don't have a huge population of kids that's done in the home. But there's definitely in larger cities, they are done in the home. I can tell you just from a nurse and what I know about these infusions, there's a high rate of anaphylaxis. So it's always good to have your child in the hospital. I mean, we've got these kids on monitors. I'm doing their vital signs every 15 or 30 minutes. I mean, we're in and out of the room constantly with these kids. And I have our pediatric hospitalists are right there. If there's any issue, they're back in the room seeing that kid, telling me what we should do next. So it's scary to do at home, but can be done at home. We're
up against a break. 721. This is fascinating. Heartbreaking in a way, right? Wouldn't it be nice if the kids didn't need infusion at all?
Well, exactly.
Yeah, we'd like to work toward that, but we're glad you're here. So we'll talk more about this when we come back. 721-1290 is our number, and we're not having any fun at all here. 721-1290 is our number. 1-800-568-5309. One thing I wanted to ask you about, Maria, before we get into the whole nuts and bolts of contact information. You had been mentioning that your nurses are very special people. So how do you go about choosing them? I'm sure that there's a lot of people apply and only a few get to be nurses there. So what's the criteria?
I don't know that we choose people. Definitely people choose pediatrics. It is a specialty. You'll hear, if you know a lot of nurses, which I know your wife's a nurse, that they'll say, I could never do peds. And what you'll hear the peds nurses say is, I could never do adults. So it's total reverse. I mean, wow. You have an affinity towards kids. So when you love to take care of kids and you're good at your job, right? I mean, you want to learn. Our nurses are certified in pediatrics. Our infusion nurses are APON certified, which means we're certified to give these chemotherapy and biotherapies to kids. We've gone to Seattle for that training. So, I mean, you want to learn. You love kids. You choose it for sure.
Wow. So I have to ask you, when a child is no longer a child but still needs the infusions, what's that handoff like? Do you have to say, hey, this lady's going to take care of you now?
Sometimes we try and sneak in some of our older kids. I mean, we do for kids that have infusions, we'll do them from toddlers all the way up to 18. But I will admit we might sneak a few 19-year-olds in there. But we do, but then the cool thing is they transition to our adult infusion unit down on the second floor at Community.
So they're still in the family.
Oh, yeah, they're still in the family. We still hear about them. And we definitely have kids with developmental delays, though, that will keep into their 20s just because pediatrics is the appropriate place for them, right? I mean, you don't want to put them on the adult floor where they might not relate to them as well. And really for those kids, they need that continuity and that trust. So.
All right.
They'll stay with us.
So naturally, now we're getting ready to wrap up. We're starting to get phone calls here, so we'll try to get one phone call in. Real quickly, how do we contact you folks?
So if you're a parent and you want to know more about infusions, you can email at pediatricinfusion@communitymed.org, or you could also call our CPG after hours line, which is 327-4170, and they will those people will be able to direct you to myself, who's the infusion coordinator. So.
You had mentioned, we have exactly 1 minute left. You had mentioned that this is the only pediatric infusion center in the state.
It is. It's the only pediatric specific unit in the state of Montana, which means that we don't do adult and kids infusions. You're on the inpatient unit at Community where we're just doing pediatric infusions, which is awesome. It's just that much more specialty for sure.
So and the media library is more cartoon focused, I assume.
Right.
Exactly.
So what do you love most about your job in 30 seconds?
I love the people I work with. I love the families, the kids I work with. I feel very supported at Community, for sure. I have an awesome team of doctors and nurses around me that at any moment I can just walk out of the room and be like, I need help, and they're there. So.
Well, we sure appreciate you being with us. We'd love to have you back.
Thanks so much for having me.
You bet. Thank you. All right, that's going to do it for Health Talk for this week. Another great guest. Good job, Robin. All right, we're going to come back. And, of course, we have another special guest coming in at 9 o'clock this morning. Michael Burks for the Missoula Maulers is going to be here in the studio. I hope you'll join us. That'll be coming up in just a moment.